Welcome to Raw Online. Now we are going to discuss pneumonia. For ease of discussion, I have divided this into two parts, part 1 and part 2. I am Dr. Sukanya. We'll go into the topics. So in this topic, part 1, we are going to discuss the definitions and we are going to see a little bit of aspiration pneumonia, causes, microbes and the treatment, and we'll discuss in detail about community-acquired pneumonia, pathophysiology, pathology and the clinical features. So the definitions, what is pneumonia? Pneumonia is infection of the lung parenchyma or the pulmonary parenchyma. And what is community-acquired pneumonia? It is an acute infection of the pulmonary parenchyma which is acquired outside of the hospital setting. Okay, that is, it is acquired in the community, not in the hospital. What is nosocomial pneumonia or hospital-acquired pneumonia? This is defined as pneumonia which occurs 48 hours or more after hospital admission, but that infection was not incubating at the time of admission. Okay, that is nosocomial or hospital-acquired pneumonia. And ventilator-associated pneumonia or VAP is a subset of hospital-acquired pneumonia which is occurring in the intensive care units. And this is defined as pneumonia which occurs after 48 hours after tracheal intubation. Okay, almost 10 to 20% of the patients receiving mechanical ventilation develop VAP. Now, what is this aspiration pneumonia? What is aspiration? Aspiration is defined as entry of the gastric or the oropharyngeal fluid which may contain bacteria or it may be of low pH or exogenous substances like ingested food particles or mineral oil, as in case of kerosene poisoning or mineral oil poisoning, or in case of drowning, salt or fresh water. So whatever it is, there is entry of gastric or oropharyngeal fluid into the lower airways. That is what is called as aspiration. Now again, you have two types of aspiration resulting in lung involvement. It could be either chemical pneumonitis or bacterial aspiration pneumonia. So chemical pneumonitis or aspiration pneumonitis, itis means inflammation. So here the aspiration of the substance, say the acidic gastric fluid, will result in a non-infectious inflammatory reaction of the lower airways and the pulmonary parenchyma. That is chemical pneumonitis or aspiration pneumonitis, which is non-infectious inflammatory condition. Whereas aspiration pneumonia, when I say pneumonia, it is an active infection which is caused by inoculation of large amount of bacteria into the lungs via the orogastric content. So that is the difference between aspiration pneumonitis and aspiration pneumonia. Now, what are the conditions which predispose to aspiration? Of course, altered consciousness. So, patients who are under altered sensorium like alcoholics or seizures, postictal state, head trauma, general anesthesia, drug overdosages. Those who have dysphagia or any mechanical motility disorders like esophageal disorders including strictures, neoplasm, diverticulars, tracheoesophageal fistulas, achalasia, etc. Neurological disorders where there is impaired cough reflex like cerebrovascular accident, multiple sclerosis, Parkinson's disease, myasthenia because of muscular poor muscle tone, and pseudobulbar palsy and amyotrophic lateral sclerosis. Or there can be a mechanical disruption of the usual defense barriers like patients who are on NG feeds or NG tube, where there could be a large volume aspiration of the stomach contents, or those who are endotracheal intubation, tracheostomy, upper GI endoscopy or bronchoscopy. Other factors like gastric outlet obstruction, large volume NG feedings, general debility, poor oral hygiene, old age, vocal cord paralysis, all that predisposes patients to aspiration. Now, what are the common bugs which are involved in bacterial aspiration pneumonia? As I said, pneumonia means there is infection. So, in community, why do you have to know this is, your treatment is tailored based on the site of acquisition of infection, whether it is community acquired or hospital acquired. So, in community acquired cases, the bugs or the microbes commonly involved are Streptococcus pneumoniae, Staphylococcus aureus and H. influenzae. Whereas those patients who develop aspiration in the hospital acquired setting, or those who have GI disorders or GI motility disorders, or alcoholics or diabetes, these patients, the common organism involved in these condition in this clinical setting are enteric gram-negative organisms like E. coli, Klebsiella, including Pseudomonas. Now, what are the common sides or lobes of affection in case of aspiration? Aspiration, as you know, it is a gravity-dependent predilection. That is, the lobes or segment of the lung which are in the most dependent portion will be affected, right? So, commonly we know aspiration is common on the right side of the lung compared to left side, because you know the right bronchus is in line with trachea, it is wider and it reaches directly into the lung parenchyma, right? Whereas left bronchus is at an angulation. So, the predilection is more common on the right side for aspiration compared to the left in whatever position it is being aspirated, right? So, aspiration in case of upright position. Here what happens, of course, the dependent portion is the lower lobe. So, basal segment of the lower lobe, as I said before, right lung is more common than the left. That is the common site of aspiration in case of aspiration in the upright position. Suppose the patient aspirates in the supine position. So, like this, the patient aspirates in the supine position. In case of right lung, right? In case of right lung, the superior segment of the lower lobe. So, this is right lung has 3 lobes, lower lobe, middle lobe and the upper lobe, right? So, in this supine position when the patient aspirates, the common site is the superior segment of the lower lobe and posterior segment of the upper lobe. And on the left side, it is superior segment of the lower lobe and also the posterobasal segment of the lower lobe. That is the common site in case of aspiration in the supine position. So, in the supine position, again right side is common than the left. In the right side, it is superior segment of lower lobe and posterior segment of upper lobe, and on the left side, it is superior segment of the lower lobe and posterobasal segment of the lower lobe. Suppose a patient aspirates in left lateral decubitus, logically left sided infiltrates are going to be predominant. Suppose a patient aspirates in a prone position like an alcoholic who falls on a prone position and aspirates, the common site of affection would be the right upper lobe. So, what you have to remember is aspiration events are gravity dependent. So, based on the position in which the patient aspirates, the location of the pulmonary opacities in the imaging differs.